Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about episode 10 of first 8 series. Today we are diving into two high yield nerve compression syndromes, that is carpal tunnel syndrome and Guyon canal syndrome. Whether you are a medical student or you are preparing for step 1 USMLE step 1 or some medical examination. So in this video I am going to cover from basic to clinicals. Okay, so let's start. So first of all we have to understand little anatomy of carpal. So first we are going to discuss about carpal tunnel syndrome. So before that we have to know little anatomy of carpal tunnel anatomy. You can see here one carpal tunnel. That carpal tunnel is very narrow and rigid passageway in the wrist formed by the carpal bones on the dorsal side of the flexor retinaculum or transverse carpal ligament on the volar side. If you are seeing this image, you can see here this ligaments is connecting with, if you are seeing this image, you can see here this ligament is connecting. Okay, first of all you have to check ulnar division. In ulnar division you can see this pisiform and hamate, this pisiform and hamate, and in radial side you can see that scaphoid tubercle and tubercle of trapezium. These two sides, ulnar side and radial side, in this side you can see one ligament. That ligament we call transverse carpal ligament, or you can call flexor retinaculum. In carpal tunnel syndrome what will happen, this tunnel, this flexor retinaculum, this transverse carpal ligament, it will become narrow or it will become rigid passageway. Okay, so that because of that thing, that median nerve will get compression. Because of that compression, that patient will feel pain and swellings and this type of things. Okay, so in carpal tunnel what are the things we can see? Median nerve, it's very important, and flexor digitorum superficialis tendon and flexor digitorum profundus tendons, flexor pollicis longus tendons. We have one fun mnemonic to easily remember this muscle. Okay, if you are seeing this image, you can see here this is flexor digitorum superficial tendon. Here you can see four muscles. Okay, and another one in down you can see three muscles, four tendons. Sorry, I mentioned muscles, it's not a muscle, it's a tendon. Flexor digitorum superficialis tendons, okay, 4, and flexor digitorum profundus tendons, these things 4, and you can see one flexor longus pollicis longus tendon, this is 9. So this 9 nerves, 9 tendons and with one median nerve. Okay, this everything we can see in one retinaculum. This is flexor retinaculum, or you can tell transverse carpal ligament. If you cross section the hand, wrist, you can see this type of image. Okay, so here this ligament is attached with pisiform, and here you can see that scaphoid tubercle and tubercle of trapezium. This carpals we have, it will forms the one ligament. That ligament we call transverse carpal ligament. Okay, and we have one funny mnemonic, that is 9 tendons plus 1 nerve when it will come trouble when tight. Okay, so this is the main thing. Now carpal tunnel syndrome. What is carpal tunnel syndrome means? That carpal tunnel syndrome happens when the median nerve is compressed inside the tunnel, and it causes, because of including, if you are seeing this first aid content, these things happening because of repetitive wrist use, like typing, mostly like working in front of computer, typing work, data entry and playing instruments, people will get this type of carpal tunnel syndrome. And we can see pregnancy female. In pregnancy female, that swelling because of that superior vena cava, inferior vena cava compression. So that time that we can see swellings in hand. Because of that swellings, we can see fluid retention, and it will compress the median nerve, and we can see in pregnancy females carpal tunnel syndrome. Okay, and rheumatoid arthritis and hypothyroidism patient and diabetes and dialysis related amyloidosis may be associated with some repetitive use. So guys, in carpal tunnel syndrome we can see some clinical features like numbness and tingling sensation and burning pain in the median nerve distribution like thumb, index and middle and half of the ring finger. And main thing like hallmark will be that pain worse at night. Okay, and we can see some like thinner eminence atrophies, but sensation over thinner eminence is spared. Why? Because the palmar cutaneous branch doesn't go through the tunnel. Okay, so how we can diagnose this carpal tunnel syndrome? If you are seeing here, we have two types of tests, special test to diagnose the carpal tunnel syndrome. If you are seeing this image, first of all, that is tunnel sign. In this tunnel sign, if you are tapping over the carpal, here if you can see this image, if you are tapping over the carpal tunnel, that patient will feel tingling sensation. Okay, so this thing, that if the patient is getting the tingling sensation, then we can call that is tunnel sign is positive. Next one, phalanx sign. In phalanx sign, we can see that if you are, we have to flex the wrist to 90 degrees for 60 seconds, same to same like this image. Okay, when you are flexing the wrist to 90 degrees for 60 seconds, we can see the pain or tingling in median distribution. This tests reproduce symptoms due to increased pressure on the median nerve. Okay, so we can do this type of tests. So what treatment we can do? Okay, mostly for carpal tunnel syndrome, the treatment begins with conservative management like wrist splints, especially at night, and we can use NSAIDs like ibuprofen and naproxen. This type of drugs we can use, and activity modification. If patient getting like too much pain, it's like very severe, then surgical release by cutting the transverse carpal ligament we can do, and like open or endoscopic surgery we can do or to relieve pressure on the median nerve. Okay, next one, yeah, next we are going to see the Guyon Canal syndrome. In Guyon Canal syndrome, if you are seeing this image, you can see one canal. This Guyon canal is less common and involves compression of the ulnar nerve at the wrist. If you are seeing this image, here you can see that the ulnar nerve is passing by through one canal. Okay, this is Guyon canal. This in this Guyon canal, if that nerve getting trapped, okay, or if that nerve ulnar nerve getting compression, or because of that hamate injury, that bleeding happens, and it is because of that hemorrhage, that because of that hematoma, that ulnar nerve getting compression, then we can see that pain sign and some like tingling sensation, this type of things in mostly pinky finger. Okay, because that ulnar nerve mostly going to pinky finger, little finger, that's why we can, that patient will feel little amount of pain and tingling sensation in pinky finger, and another one off the ring finger, like. Okay, so this Guyon Canal syndrome is compression of the ulnar nerve at wrist or hand, commonly involves and we have one mnemonic, that is ulnar trap, TRAP. In ulnar trap we can see T means tunnel like Guyon Canal, and R means riders, that means mostly that cycling person, okay, and bike riders will get this type of ulnar compression Guyon Canal syndrome. Okay, and A means at hook of hamate, here at hook of hamate we can see this problem, and we can, P means pressure from handlebars. Okay, so what are the symptoms we can see in this patient? Numbness, tingling in ulnar distribution, we can see pinky and half ring fingers, this numbness and tingling sensation, and we can see some weakness in interossei muscles, that the weakness will be, the patient will get in grip, and may occur in cyclists due to prolonged pressure from handlebars. Okay, so today we discussed in this episode 10 carpal tunnel syndrome and Guyon Canal syndrome. These are highly testable and clinically important topics. So don't forget to like, share and subscribe to follow this first aid series. So in our next episode 11, we are going to discuss about total we are going to cover lumbosacral nerves and the lumbosacral plexus and what are the nerves, innervation, everything, anatomical part, everything we are going to discuss in our next video. So take care, bye bye.